Thank you. My name is Christy Brooks. I live in Chesterfield County. Bear with me, I'm a little nervous, and this is an emotional topic for me. I'm a stay-at-home mom. I have 2 young daughters. In 2003, I was pregnant with my second child. It was a wanted pregnancy. It was a planned pregnancy. Everything with the pregnancy progressed fine until we went for our 20-week ultrasound. This is the point where most parents find out if it's a girl or a boy and get to paint the room pink or blue. But instead of finding out just if it was a girl or a boy, we found out that our baby had a fatal birth defect. She was diagnosed at 20 weeks with a condition called congenital diaphragmatic hernia. And basically what that is that she had a hole in her diaphragm. And because of the hole, her stomach and her intestines migrated up into her chest cavity. This pushed her heart over into her right armpit and prevented her lungs from developing. So at the time we were presented with our options. We could continue the pregnancy, carry her to term, and then watch her suffocate to death at birth, or we could interrupt the pregnancy at 20 weeks. We debated for about a week on what to do. We sought out another medical opinion. We had high-resolution ultrasounds. We did endless hours of internet research. And finally, my husband and I decided that we were going to interrupt the pregnancy. We felt that was the best thing to do, not only for the baby, but for our entire family, because we had a 2-year-old to take care of and no family in the area to help out. So I called my OB and let her know that we had decided to interrupt the pregnancy. She told me that I had 2 options. I could either have a surgical termination, which is a dilation and extraction, or D&E. And that would mean that I'd go into the hospital, I'd be put under general anesthesia, and then they'd remove the baby. This wouldn't allow me to see the baby or hold the baby or say goodbye. My other option was to be induced into labor at a hospital, just like any other full-term induction. Because I had carried this baby for 5 months and bonded with her, I knew that that was the option I had to choose. So at 21 weeks and 5 days, I was induced into labor at Henrico Doctors Hospital. And after 16 hours of labor, I was able to deliver my baby girl. Because I was able to choose that option, I was able to see her and hold her and kiss her and take pictures and properly say goodbye to her. Now, what I didn't realize at the time was that there was a cost difference between these 2 procedures. If I had decided to go with the surgical termination, it would have been about $5,000 without insurance. If I had decided to go with the labor and induction without insurance, it would have costed me $15,000. Now, luckily for me, my insurance did cover my L&D induction. My OB was great about it. She took care of all the pre-approval before. I didn't have anything to do with that. But a few weeks after my termination, I started getting the explanation of benefits forms from my insurance company in the mail. And it was then that I realized how expensive it would have been if my private insurance had not covered it. So I'm here today to speak in opposition of this bill, because if private insurance companies are banned from covering these types of procedures, you're going to be taking families that are already emotionally devastated, and you're going to be financially devastating them as well. At the time, we were a single income family. We didn't have family in the area to help out. Just 10 days before we got the diagnosis, we had signed the paperwork to start building our first home. We had no savings, we had nothing. If my insurance hadn't covered this procedure, we would have been devastated. And not only that, if I had known ahead of time that I would have to pay $15,000 in order to properly say goodbye to my baby, I might have had to choose the surgical option, which wouldn't have allowed me to do that. Thank you.
Thank you for taking your time to be here and present a difficult testimony.
Hello, members of the committee. My name is Tarina Keene. I'm the Executive Director of NARAL Pro-Choice Virginia. I am here to oppose HB 2147. I know there was a lot of fervor around the abortion issue, but what I hope you understand, like Christy, no woman ever plans on having an abortion. But if the insurance coverage is there, that's why insurance coverage is there, is to accommodate these kinds of situations. And thankfully, most women already have this coverage. A majority of insurers have made abortion coverage part of the health plans they offer because they recognize a need for this health care option. And I can assure you that insurance companies do not want to be told by the government that they have to limit the benefits included in their plans, especially if they have customers who want or need to purchase this coverage. Furthermore, this proposal runs contrary to Virginia's record of allowing private industry to operate free from government interference. The Commonwealth has never before prohibited insurers from covering a particular benefit in private insurance plans, nor has Virginia ever told employers that they can't cover a certain benefit for their workers. Yet that's exactly what this bill proposes to do. It tells thousands of small business owners that they cannot buy coverage for their workers in the new health system, and that they cannot offer employees, comprehensive insurance coverage as well. This bill is the ultimate example of government intrusion into private contracts, private businesses, and most importantly, private people's lives. It not only takes autonomy away from private employers, it takes benefits away from customers. A majority of insurance plans already cover abortion, so this bill would take away coverage that women already have. Around the country, millions of women are finally getting the opportunity to join the health insurance rolls through the state exchanges. And HB 2147 would ban the many women who are joining the exchanges as either individuals or as employees of small businesses from having the same insurance options as all other women in the private market. Furthermore, this proposal is extreme because it offers no exceptions, not for the health or the life of the woman. It doesn't even offer exceptions for rape or incest. Each year, approximately 25,000 women in the United States become pregnant as a result of rape. Proposals like this insurance ban are callous, and they compound the trauma of rape by leaving survivors without access to the full range of reproductive health care options. These bans have a particularly cruel effect on young women, because as approximately 30% of rapes involve women under the age of 18. They are mere high school students. They are mere children. Healthcare reform was designed to open up the doors for people who have too long gone without adequate health insurance and health care. It was designed to protect women's health, not impede it. It is not the government's place to interfere with the private doctor-patient relationship by telling an individual that she cannot have coverage for or access the necessary medical care she needs. Instead of spending our time limiting options, let's focus on including services in the insurance exchange to help reduce the need for abortion. Full coverage of prevention services such as birth control, STI testing, breast and cervical cancer testing, pap smears. Let's do what it takes to make sure that a woman is healthy and ready for motherhood. Thank you so much for your time. I appreciate it.
Thank you.
No problem. Good evening, Mr. Chairman and members of the subcommittee. My name is Jessica Honke, and I'm the Director of Public Policy for Planned Parenthood Advocates of Virginia. Our mission is to ensure that individuals and families have the freedom, information, and ability to make their own informed reproductive choices. I'm here today to oppose House Bill 2147. If enacted, this extreme measure would result in women losing benefits they currently have, since it would take away abortion coverage. If abortion coverage is banned in Virginia, it would result in drastic and dangerous implications for some women in need of serious medical care resulting from complex and sometimes life-threatening pregnancies. Further, there are no exceptions in this bill for rape, incest, or for the life of the mother. Current insurance plans cover abortion when a pregnancy is complicated by a health condition of the woman or the pregnancy, as you've heard, as these procedures can be prohibitively expensive. If the abortion coverage ban passes, it will eliminate coverage for these procedures, and women making the most difficult personal and medical decisions of their lives will also face costly medical bills they simply cannot afford. Abortion is a legal medical procedure, and most insurance plans already cover it. In this time of economic uncertainty and hardship, Virginia should be doing everything it can to provide help to women and families. The last thing we should do is take away important health coverage from them. Thank you.
Thank you, Mr. Chairman. As was said, this bill has been introduced in keeping with the provision of the federal health care law, which says a state may elect to prohibit abortion coverage in qualified health plans offered through an exchange in such state if such state enacts a law to provide for such prohibition. This would enact that statute and keep in line with Virginia's tradition of not allowing funding to go towards abortions.
Further testimony? What's the pleasure of the subcommittee? Delegate Morgan.
Dr. Klein, Would you consider an amendment that would draw out private insurers?
Well, Mr. Chairman, I would say that because the exchanges are private, those are made up of private insurers participating in the exchanges, it would affect the entire exchange. That's what the exchange is going to be made up of.
Tell your more.
Do you know whether private insurers will be able to offer insurance outside of the exchange?
Mr. Chairman, I'd say I believe they will. They will be able to participate in the exchange and, I believe, participate outside of it as well. But I will check with Doug to make sure.
We don't know yet, but
Okay.
maybe.
That's right, the exchange rules aren't made up.
I guess maybe, Mr. Chairman,
Tell your more.
would you agree that this legislation may be a little premature?
It is definitely getting in front of what could be a very serious problem.
I'll get Lewis, I believe you're.
Sir, Mr. Chairman, I'm not trying to beat a dead horse or give you a hard time about it, but I mean, along the lines of Delegate Morgan's question, could you somehow tailor it just to flatly say that there's no state funds to be used to subsidize any plans in the exchange that provide abortion coverage? And then if this, as Mr. Gray said, if you've got plans in there that are non-subsidized in the exchange, I just feel like we're, as I said earlier, maybe painting with too broad a brush on it. That's just it's just my thought. That's your bill.
I think that because of the fungibility of money, that you would end up supporting plans that cover abortion within the exchanges, even if the policies go to people who do not receive directly funding subsidies for those abortion services.
All right, you've got the testimony. What's the pleasure of the subcommittee on the bill? There's a motion to lay the bill on the table. I haven't got a second yet. Is there a second? Second, okay. Substitute motion. All right, substitute motion is to report, and there is a second. Is there discussion on the substitute? Hearing none, those in favor of the substitute signify by saying aye. Aye. Those opposed? No. Okay, we got a tie vote. That motion fails. We're now at the underlying motion, which is to table the bill. Discussion on that motion. To table. This motion is to table. Non-debatable is correct. All right, those in favor of the motion to table the bill signify by saying aye. Aye. Those opposed? No. All right, Chair is going to rule that the ayes have it.